In his remarks made at the briefing on COVID-19 epidemic prevention and control most recently, Chairman of Cần Thơ City People's Committee Trần stated that Cần Thơ must continue to implement various measures to contain the epidemic, support people, and supply food to ensure daily meals of households.
According to the report of the Health Department, nearly 20,000 test samples was collected on July 28, and about 13,500 test samples were collected on July 29. 31 hospitals in the area have promoted supervision to proactively prevent and control the transmission of COVID-19. Among them, 28 units have performed rapid screening tests for their staff and patients. 100% of the 30-level hospitals have prepared the screening, categorization, and quarantine zone if a probable infection case is detected. Chairman of Cần Thơ City People's Committee Trần evaluated that the forces have worked night and day to trace and acquire the fastest confirmation test result. Great efforts have been exerted for the test since units had to take on many works at once. The city has control over the epidemic despite its complicated progressions.
The force must closely coordinate and speed up trade for F0 and F1 individual. For places that are considered safe, we must expand the green zones, tighten red and yellow zones, bring F0 individual to place for treatment, so that only the treatment place remains red zones. As long as there are green zones, we must set up checkpoints and strictly protect them from infection.
The Ministry of Information and Communication evaluated that Cần Thơ and Ho Chi Minh City are the two localities that strictly implement Directive Number 16, thanks to people's awareness and constant supervision and patrol of competent forces. However, the number of people going outside is still high in 4 districts. Localities should come up with methods to manage shippers and only allow their operations when safety is ensured, and at the same time consider the suspension of household businesses, food and fast food retailers from 6 p.m. to 5 a.m. the next day. Voluntary groups dedicated for going shopping need to be established for areas under lockdown at communes whilst in town. Supervision and checking for medical declaration at households must be promoted and reported to the city authorities at 4 p.m. every day. Especially authorities at all levels also support people in relieving the pressure caused by social distancing.
Food is the most basic need for people. Food must be supplied so that people can enjoy at least 3 meals a day. Secondly, people's physical and mental welfare must be taken care of. We have established channels and expert groups to provide healthcare consultation. I suggest the health sector check and supply the list of experts in mental health and healthcare to take care of people's welfare. Along with supplying food, we must supply essential medicine for people.
The chairman of the City People's Committees also directed the department and sectors to coordinate to organize concentrated quarantine for residents of Cần Thơ City returning from the cities and provinces of Bình Dương, Đồng Nai, and Ho Chi Minh City. Cần Thơ City has equipped ventilators for severe patients at city-level hospital and is mobilizing more ventilators for patients with mild and moderate symptoms at the field hospitals. However, the units need to soon check and prepare equipment, forces, chemical and biological products, and report to the health department for timely equipment plans.